Good afternoon, everyone, and thank you for a few minutes of your busy day. I believe, though, our back care team has created a proposal that will benefit many and make this worth your time. I would like to introduce the members of our back care team. Sarah is an RN at our facility. She has personally experienced work-related back pain and offers insight from a patient and nurse point of view. Marie is an RN in our occupational health clinic. She is well versed in the mechanics of physical movement as well as knowing the benefits of specific interventions. Georgia is our financial analyst. She participates to make sure our proposal has stayed responsibly within budget as well as devising our plan for sustainability. My name is Karen. I am the Director of Rehab Services. As a director, it is my responsibility to ensure we are allocating resources to appropriate causes that support our mission, values, and strategic plan at DRHA. DRHA embodies a spirit of caring and promoting healing environments across the lifespan and across the continuum of care. Health promotion means improving current health and reducing risk to maximize a person's well-being in all stages of health. Our proposal is congruent with all that DRHA strives to be, from our mission to be leaders in our profession, to our values of being an industry benchmark, to our strategic plan that supports health promotion and risk reduction for patients as well as staff. Our team has used the social cognitive theory of behavioral change. Our target population is educated and health literate. They do understand cognitively what is healthy and what isn't. Our team needed to understand what would motivate our target population to make behavior changes. Social cognitive theory states that behavior is based on environmental influences, personal factors, as well as self-efficacy. We believe our intervention addresses all of those factors. At this time, I would like to turn things over to Marie.
Work-related musculoskeletal disorder will be referred to as WMSD for this presentation. WMSD are injuries involving muscles, nerves, tendons, joints, and cartilages. Our target population is 36 to 64 years of age. WMSD attributes to 8 days away from work compared to 6 days for all non-fatal injury and illnesses. Back symptoms are among the top 10 reasons for medical visits. The lower back, most commonly affected area. Job risk factors that contribute to WMSD are working in the same position for long periods of time, working in awkward or cramped position, or handling excessive number of patients in one day. Sarah is the RN on the med-surg floor. Transferring patients from bed to chair, she injured her lower back and neck. She had occupational health, and after administering some diagnostic tests, which come back negative, we give her a on a general medical occupational history and then assess her muscular endurance, strength, and flexibility. Results from the questionnaire, we learned that she has had pain in her lower back and neck for about 6 months. Taking a lead pain sometimes helps. She occasionally walks on a treadmill when she has time. Her muscular endurance and strength and flexibility, we see that she is weakened in her muscles in her back, arms, and legs, and that she has decreased flexibility in the same areas. At this time, she's planning to attend a class that she has heard about, that her goals, which are strengthening her core, increased strength and flexibility to her back, legs, and arms. I asked her to follow up with me in a month to reevaluate her pain. Sarah returns to the clinic excited about the class that she is taking and that her pain in both her lower back and neck has reduced considerably. She also notices more strength to her core and back and legs and arms and some flexibility. I encourage her to continue taking the class since it seems to be helping. I call and schedule a meeting with Karen, our rehab director, and Georgie, our DRHA, our finance consultant, to in detail this particular program to see if it would be feasible and beneficial for DRHA and our surrounding community. And now I turn it over to Sarah, who will talk about her part of this presentation.
Thanks, Marie. WMSDs impact the individual as well as the workforce. Not only do these injuries cause pain and prevent these individuals from performing their job function, they also cause time away from work that may place a financial burden on the individual. WMSDs also significantly impact the employer, in this case DRHA. WMSDs can cause a decrease in employee morale and increase staff turnover. Work-related injuries also have financial implications caused by overtime hours and workman's compensation claims. When my own injury occurred, I was off from work for about a week. When I returned, I had several restrictions to follow. I know that these place additional burden on my coworkers, and it made me want to heal as quick as possible. That is what first sparked my interest in our intervention of yoga. Yoga is a holistic healing method that has been around for centuries. Yoga combines physical activity with breathing, relaxation, and meditation to facilitate improved health and wellness. Yoga uses a variety of techniques and poses to achieve good posture, which helps to decrease strain on the back and neck. There are several different types of yoga which allows for its performance by all ages, regardless of current level of physical activity. Yoga has been shown to be beneficial in certain medical conditions such as obesity, diabetes, cardiovascular disease, and low back pain. It also helps to alleviate symptoms associated with stress and anxiety. This is particularly useful in our population, as many reports to our occupational health office have been for musculoskeletal injuries, particularly low back pain. For our intervention, each individual will participate in 1 to 2 classes per week of low to moderate intensity yoga. Classes will be 1 hour in length. At the beginning of each class, the individual will fill out a brief questionnaire regarding their pain level, location, and any other symptoms they may be suffering from at that time. At the end of the prescribed session of 8 to 12 weeks, the individual will be seen again in the occupational health office for more in-depth screening and evaluation of outcomes. Georgia?
Sure. Well, they say the devil's in the details, so I'm here to talk to you about the details. This procedure will involve sending 2 physical therapists for certification as yoga instructors. The tuition is $1,500 each, and in addition, there'll be about $288 in travel costs to get them to the training sessions. Sarah did some research, and we will need to buy mats and materials for use for the participants, and that's going to cost about $675. This is assuming a maximum class size of 5 students at any one time, which we really think is appropriate for one instructor. And finally, there'll be a salary and benefit burden for the additional hours engendered by the therapists to teach the classes. We estimate this to be about 3 hours per week for a total of 1 to 2 one-hour classes a week. The additional hours total $156 per calendar year, and that's going to cost DHRA about $5,304. So the total cost for a 12-month period is going to be $9,267. This will almost exhaust our $10,000 grant, but it will leave us about $700 for contingencies. And, we folks in finance, we like to have that a little bit of cushion. Anyhow, research into the evidence shows that the most successful programs are those that have strong outcome measures. We intend to measure outcomes related to decrease in lost time, prevention of future lost time, and colleague satisfaction. By demonstrating a commitment to caring for the colleagues' well-being, we also think will engender some high colleague engagement and retention. Since our eventual goal is a program of demonstrated value which we can market to the community, it's going to be important to have this hard data in the form of before and after metrics to provide proof that our program delivers on expected results. The important thing is going to be sustainability. The offered grant of $10,000 will cover the cost of the initial year, and we'll be using the existing resources of the rehab department The majority of the expense is going to be in educating the instructors and obtaining the mats and materials that we need. There will be some associated increase in salary dollars for the additional hours that are just needed by the instructors, but it's pretty minimal. The assumption is that the program is going to result in decrease in injuries and a resulting decrease in disability and worker comp payments. That can be huge for the organization. This decrease could justify sustaining the program after the pilot year, and the data that we collect could be used to demonstrate the effectiveness of the program and market it to area employers. I like that idea because I think that'll result in a revenue stream for our organization. I will be glad to provide a handout of the detailed budget to any of you wishing to see the actual figures. We'll have that available at the end of the presentation in the back of the room. Thanks. Karen, you want to wrap it up?
Our intervention for back injury rehab and eventual use for back injury prevention highlights our dedication to all populations, including our staff. Our back team believes we have met all of the advisory board goals and requirements. We are excited about this proposal and especially like that not only does it benefit our current employees and facility, but that it is sustainable and may actually increase revenue in just a few short years. As Georgia had mentioned previously, eventually we envision using this intervention as a marketing tool, which will raise community awareness of DRHA's commitment to improving health in all stages of wellness. Thanks again for your attendance to this presentation, and I certainly hope you have found it worth your time. Copies of our proposal are available at the back of the room, along with a reference list. Our team hopes you are now as excited about our proposal as we are. Thank you for your support, and please enjoy the rest of your afternoon.